Hey guys, it's Dr. Mazur here at Cumberland Chiropractic and Sports Medicine. Today we're going to talk about low back pain, specifically lumbar facets. Stick around. Okay, so the facet joints are the joints in this low back that interconnect each vertebrae, the above and below vertebrae, and they kind of act like guardrails where they allow for motion, but a certain type of motion and a certain amount of motion. And we can irritate these, and you'll know because you'll have sharp pain, maybe dull, achy, pinch-like pain when you go to extend. So if you look in the mirror and you notice your pelvis dumping forward, which we call anterior pelvic tilt, then that leaves you susceptible to pinch or jam up those facet joints. So things that drive that anterior pelvic tilt are overactive hip flexors. A couple stretches you can do are a standing hip flexor stretch. So if you have something sturdy that's about knee height, I would square up with it, line up with it, bring one leg up just like that as you posterior pelvic tilt. So I need you bringing the hips back. So if we're falling into this, I need this back, bringing up the foot, both feet pointing straight forward. I need you leaning straight forward here. You should feel it on the front side of the hip, no pain in the back. If you're not feeling it there, then play with the height. Make sure it's sturdy, but play with the height of what you're using, and maybe play with how far the foot is out. But you should feel all in front of the hip there, and do it on both sides a couple times, a couple minutes a day. Then I want you to do one on your back. You're gonna need a couch or the side of your bed to do this, but I want you laying one leg off, just like this, keeping back flat. So if I move this chair here, keep the back flat, grab the opposite knee, and I want you bringing that knee to you as you're letting that leg fall down to the ground. You should feel it on the front side of the hip. Do that on both sides. Okay, so if you fall into that anterior pelvic tilt presentation, I need you learning that. I need you practicing this pelvic tilt, posterior pelvic tilt, and get a neutral spine that'll offload those facet joints. That's huge. Then I want you learning to activate your core. So I'm talking about intra-abdominal pressure. This will help neutralize the spine, and it'll help so that you're engaging all the muscles and not chewing up those facet joints. So what that looks like is expanding your waistband. You're filling up your balloon all the way around, 360 degrees, you're filling up your balloon. Breathing deep into the diaphragm. If you want, you can grab a band, you can put it around your waist, and you can press out into it. But do this while keeping that pelvis tilted back. One last thing, if you're a belly sleeper, I know it's a hard habit to break, but put a pillow under your pelvis, under your belly. That'll help release some of the pressure that you're putting on those facet joints. So if you've tried all these tips, you've done icing, you've done these stretches, you've done the pressure in the pelvic tilt, and you're still having low back pain, go ahead and give us a call. We see this stuff all the time. We'd love to help you. This has been Dr. Mazur here at Cumberland Chiropractic and Sports Medicine, where we can get you better faster.